hospital?
Not that I'm aware.
Did you observe any cuts, abrasions, or blood on the area of her head?
No.
And based on your review of those findings on the CT scans, was there any noted injury from the head CTs that you could tell?
No.
And were you able, after using that bear hugger device, able to get her her core body temperature back up to normal?
I don't recall.
Did you ever observe those wounds that you observed on her neck or her wrists ever start bleeding actively again?
No.
I have nothing further.
Mr. Reddington.
Morning.
Morning.
So, would you agree with me that when Lindsay was brought into the South Shore Hospital that she was unconscious?
I recall her eyes being open, but she was nonverbal.
Okay. So, as an experienced emergency room doctor, can you tell me when someone's unconscious, what is that? What are the symptomology of it? What does that mean?
Usually means they're completely unresponsive with eyes closed.
Okay. Was she responsive?
Not verbally.
Was she responsive at all?
She was responsive to pain.
So that means that you would do something to cause pain, perhaps the bottom of the foot or whatever it is, to see if they have a reaction?
Correct.
And would you agree with me that when people even have very, very serious brain injuries, that they can respond to pain stimuli?
Sometimes.
Sometimes. So her eyes were open. Were her pupils equal and reactive to light?
I don't recall.
You don't recall. What does it mean with PERL, pupils equal reactive to light? What does that mean?
Exactly what you just said. It means her pupils are equal and reactive to light.
And as a doctor, what does that tell you?
It tells me that there's no significant neurologic injury.
And in this case, you don't recall if her pupils were equal or reactive to light?
I don't.
Okay. And that's when you take the little flashlight sometimes and you put it over the eye and see if there's constriction of the pupil.
Correct.
Did you do additional evaluations of her to see what her neurological function was?
She was pretty quickly intubated from what I recall, so after that it would be difficult to assess her neurologically.
Sure. Was she on any pain medication, if you remember?
I don't remember.
You recall, did she have difficulty being intubated? I mean, would you agree with me that if you're not under some type of medication or sedation or unconscious, it hurts to be intubated, doesn't it?
We wouldn't intubate somebody without first giving them some induction medicines.
Okay. So what would the induction medicines be?
They're not universal.
Well, what
would depend on the
What are the
case.
induction medicines that you used on Lindsay Clancy?
I don't know. I'd have to refer to my record, and also I wasn't the one who did the intubation.
So she was intubated, had the tube coming out of her mouth, she's laying on the table, and you are continuing an assessment. You were the lead doctor in the emergency room for Lindsay Clancy, right?
I wouldn't say I was the lead. I think the trauma surgeon and I worked together.
Right. Her temperature, her core body temperature was 82 degrees, is that right?
If that's what the record states, then yes.
I'm sorry?
If that's what her medical record states, then
Well,
yes.
as you sit here, you don't know what her core body temperature was?
I saw her 3 years ago. I see about 200 patients a
I'm
month.
sure you're very busy, but this is a murder trial, doctor. Did you review your records and your notes?
I'm happy to look at my record if you bring it
Did
here.
you review your records and notes before you came in here today to testify on this case?
Sir, I did, but I don't have a photographic memory.
Did she regain consciousness at all while she was in your emergency room?
No.
Can you tell me what CSF is?
Cerebrospinal fluid?
Yeah. Is that what that is? CSF?
But it could be. I'm not sure in what context you're referring to it.
Well, how about if there's a massive leakage of CSF from her nose? What does that tell you as a doctor?
It could mean that there's a skull fracture.
Did you notice any clear fluid coming from her nose?
I did not.
Is that something you would look for?
Yes.
How quickly do you get the results of the x-rays? when you're in the emergency room?
Well, these were CT scans, but fairly quickly in a trauma.
I'm sorry, CT scans, x-rays. So you had CT scans that were able to show you the damage to her neck and upper chest, is that right?
Yes.
And what did those CT scans show you?
Well, what I remember is a thoracic spine injury.
And when you say a thoracic spine injury, would you agree that top part of your neck, your throat area, would be cervical, right?
Correct.
And that's when the numbers go C1, 2, or whatever they are. That would be the actual vertebrae in the cervical area of the upper body, correct?
Yes, the cervical spine.
Okay. And then below the cervical spine would be the thoracic spine. Is that correct?
Correct.
And the thoracic spine would be, and sometimes they're delineated as T1, T2, meaning thoracic 1, thoracic 2, all the way down to what, 5 or 6?
12.
I'm sorry?
12.
12. So when you looked at, and the lower portion would be the lumbar, is that right?
Correct.
Now, when you looked at the CAT scans, did you determine the extent of the injury to the spinal cord?
I could determine the extent of the injury to the bony thoracic spine.
Okay, what was that?
I don't recall exactly the level. I would have to look at the report.
What does that mean, the level of the T?
Correct.
Was her cervical spine injured?
I don't recall. I'd have to look at the report.
Were you aware that her thyroid was crushed?
I don't recall.
Do you know that her cervical spine vertebrae was fractured, destroyed?
I don't recall.
Doesn't that control a person's breathing? Does that have anything to do with breathing?
It can.
What do you remember about looking at the damage to the spinal cord depicted on the CAT scan?
What sticks out most in my mind is her thoracic injury.
Okay, and what was the thoracic injury?
I don't recall the exact level.
What does it mean by effect level?
The exact level.
I'm sorry. Were you aware that there was a complete transection of the spinal cord on T5 and T6?
I'm sure I was aware at the time, yes.
Okay. And just, can you tell me what does it mean when it says a complete transection of the spinal cord at a particular, apparently that would be at thoracic 5 and thoracic 6, right?
Mm-hmm.
What does that mean with a complete transection?
It means the bones are no longer one on top of the other. They're moved apart.
Were you aware that there was a significant edema noted in her chest?
If